This is TTT Live. I am DK Roster. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager, Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, Trinidad and Tobago. Welcome to today's edition of the Ministry of Health's virtual media conference on the national COVID-19 response. And we've come to you today on a Friday. We will focus on the COVID-19 variant strains this morning. The members of the panel are the Honorable Terence Deyalsingh. And my apologies, everyone. My mic was off, so I start again. Welcome, everyone, this morning to the Ministry of Health's virtual conference on the COVID-19 response. The members of our panel this morning are the Honorable Terence Deyalsingh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Dr. Avery Hines, the Technical Director of the Epidemiology Division. I am your moderator, Candice Alcantara, Manager Corporate Communication at the Ministry of Health. And we begin this morning with an adjustment in our normal order. We go to the Chief Medical Officer, Dr. Roshan Parasram, who will give the clinical update and some information related to this imported case of the UK variant of COVID-19.
Hi, thanks, Ms. Alcantara. Good morning, Honourable Minister, Dr. Hines, members of the media, members of the viewing and listening public. I'll give the clinical update first for January 21st at 4 p.m. So the total number of samples submitted to public and private facilities just under 80,000. We're now at 79,908. New positives over the last 24 hours, 20. Total positives since March 12th now stand at 7,450. Total recovered patients, 6,974. Total active cases, 343. Deaths now stand at 133. We have at our step-down facilities 6 persons, at our hospitals 41. Quarantine sites, we actually have 312 as per our update this morning, and total persons in home isolation 276. By way of hospitals, the patients are spread between the Couva Hospital and Multi-Training Facility, where we have 24 persons, 1 of those in ICU. At the Cora Facility, 12. At the St. Anne's Hospital, 1 person, and Scarborough Regional Hospital at the Fort, there are 4 individuals. With regards to step down, giving us a total of 6, we have 2 at the Claxton Bay facility and 4 persons in Tobago. As it relates to quarantine, we have a number of sites occupied at this time. Total persons are 312, the Chancellor Hotel 14, Cascadia Hotel 45, Home of Football 16, Regent Star 11, Paria Suite 67, UE Canada Hall 56, Cara Suites 7, Cape Park Hotel 95, and the Tradewinds Hotel. There's 1 individual left. By way of the patient that would have been described at the press release yesterday around just before 4 p.m., we have our first case of confirmed the UK variant in Trinidad and Tobago. So the person is a repatriated national, as the press release would have indicated. They would have come in on a flight that left the UK on the 6th of January from UK to Barbados, then Barbados to Trinidad. The person would have had their normal 72-hour PCR prior to coming onto the aircraft, meaning that more than likely they would have been flying in a negative status as it relates to COVID-19. Upon arriving into Trinidad, they would have been allocated to go to the Paria Suites Hotel. So thereafter, they were taken as per protocol via the Defence Force directly to the hotel. Persons was in a single occupancy room, traveled alone, so no one else was in that particular room. Upon doing the day 6 swab, which is again part of the normal protocol, we picked up a positive on that particular patient. The patient was then taken to a step-down facility with other positives, and shortly thereafter taken to the Couva Health Facility in an isolation area because of the transit from the UK, bearing in mind there was a concern from the variant being in the UK going backwards to December of 2020. So thereafter, as per the protocol for the genomic sequencing program, which is a program run between UE, the Caribbean Public Health Agency, and Trinidad and Tobago, the sample was thereafter sent to UE for genomic sequencing, And at 12:36 p.m. yesterday, Professor Carrington would have informed me directly that the case was indeed the UK variant. She did pick it up by sequencing. At around 12:36, I was informed. I got a report late last night, a formal report about 8:30 last night, indicating the same thing. So in her report so far, she would have actually been able to sequence so far from Trinidad and Tobago, going all the way back for cases that have come into the country since September to present. A cumulative total of 94 samples were sequenced, and out of those, she would have had her first of the B117 lineage yesterday. So bearing in mind with all other occupants of the aircraft, in total on that flight on that particular day, there were 49 individuals on the flight destined from UK to Trinidad. And of those, all of them would have been put into quarantine facilities, including Paria suites, and all of them would have already spent their 14-day period in those facilities. And of course, the ones that would have gone home would have had a day 6 negative before they were discharged home. So all things being equal, the protocols were managed, were put in place to assure decreased risk of anybody with COVID-19 going into the population. And through the protocols, we were able to pick up and sequence the first case of B117 in Trinidad and Tobago. Candice, that's my clinical update for this morning.
Thank you very much, Dr. Parasram. And we've heard so much about COVID-19 variants. And we go to Dr. Hines, who will provide some general information on this COVID-19 variants. Off now to Dr. Hines.
Thank you, Ms. Alcantara. Good morning to the Minister, to the CMO, to members of the media, members of the viewing and listening public. I'm going to go to a couple of slides where we explain in a little more detail the significance of and the science behind what we're referring to as the COVID-19 variant. May I have the first slide, please? So we're going to speak about the SARS-CoV-2, which is the virus that causes COVID-19, and the variants of public health concern that have been detected in the global population to date. Now, what is a viral variant? A viral variant is really just something that occurs, a type of change within the virus that occurs when the virus replicates, makes copies of itself, and it changes a little bit from one generation to the next. Each time it replicates, small changes occur. Those changes are called mutations. And a virus with a few mutations may be subsequently classed as different enough from the original to be called a variant of the original virus. And the more viruses circulate, the more they have the opportunity to change. This is normal, it's expected, it is part of normal viral biology. But these changes sometimes result in a variant, a different version that is better adapted, better suited to its environment, and it can either behave differently from the point of view of making people more ill or spreading more quickly. So that evolution of the virus can sometimes be of concern if we are getting the impression that those changes are changing the virus's behavior. We need to lose the bottom ticker so that we can see that last point on the slide. And the changes that we're speaking about, public health concern, are really the two that I just mentioned. Either the virus gets transmitted more easily, or it gets more severe. People get more ill. So those are the two things we're going to discuss in respect of this particular set of viral variants that we're talking about for SARS-CoV-2, the COVID-19 virus. Next. So main concerns around new variants of this virus. Main questions are, will it spread more easily? Can it make people more ill? Does it make people more severely ill? Does it make the virus harder to detect when the virus changes? And does it make the existing vaccines less useful? Those are the main questions that are of public health relevance. So answering for the variants that we have noted thus far, does it make the virus more easily spread? In this case, the UK variant for certain has been seen to spread with greater ease, and it's been estimated to be between 50 and 70% more transmissible in various studies. So that is a matter of public health concern. That's why it's been flagged, and that's why we're speaking about it in these terms. Does this change make the virus more severe? At this point, there's no evidence that suggests that viral illness with the variant is any more severe. People don't stay in hospital longer, and they're not any more likely to die. The disease is not more severe, whether they have the variant or the original virus. So no, the severity hasn't been changed at this point in time. Do these changes make the virus harder to detect? At this point in time, because the PCR testing looks for lots of different parts of the viral DNA, not just one bit, then the testing itself has not really been affected by the changes in the virus, and both the antigen and PCR tests still perform basically as expected. So nope, the testing has not been affected. It's not any harder to detect the variant at this point in time. Last question, do they make existing vaccines less useful? At this point, with the data available, there is no evidence that the vaccine efficacy has been diminished to any significant extent. The review of occurrence of the virus with people who've been vaccinated and not is ongoing. So that will be updated, but up to now, there is no evidence that the vaccine efficiency, its ability to prevent illness, has been diminished even with this new variant. Next slide. So really, we've been speaking about two types of variants that have caught the public attention. So we're just putting that information into accessible format here. So that first variant, which we refer to as the UK variant, which you also heard referred to as the B117 lineage, was noted as at the last update on the PAHO website at the 19th of January. So already be in 60 different countries outside of the UK. And it's been found in all the various WHO regions, or 6 of the WHO regions. At this point in time, the other variant, called the 501V2, or the B135 lineage, which is the South African variant, has been found in 23 countries outside of South Africa. And we continue to monitor the spread of these variants, both of them, across the globe. And we continue to be in contact with PAHO and WHO to see whether there are any changes in the prevalence of new versus old versions in the various countries of the world. Because just having the variant having been detected doesn't mean that it's in the general population in any of the countries. Some of the cases are imported, and in some other instances, in some other countries, there is what they call community transmission. It is important to note that at this point in time, the variant was detected in someone who was repatriated. Therefore, it was not detected in our local population. It was detected and contained by the protocols that we have in place for repatriation and for biofiltering, preventing people with COVID-19 from getting into the population when they come back from foreign countries. So that detection, those protocols, have managed to allow us to both detect and contain this case, and we have not to date detected any of those variants in the population. We continue to do surveillance on both the repatriated and to some extent on local samples to continue to look out. So that brings me to the end of my slides. Back to Ms. Alcantara.
Thank you, Dr. Hines. And now that we have some background information, we go to the Honorable Terence Dayal Singh, Minister of Health, who will speak from a national policy perspective.
Thank you very much, Candice. Good morning to the Chief Medical Officer. Good morning to Dr. Hines. Good morning to ladies and gentlemen of the media and to the wider listening and viewing public. Today is the 22nd of January, 2021. It is almost a year since the government of Trinidad and Tobago started its COVID-19 response. And just want to recap what we have been doing over the past year from a policy perspective. Our first policy intervention was on January 29th, 2020, when we started thermal screening. And from then to now, this government has taken over 160 or have made over 160 responses and statements. On January 30th, we imposed our first travel restriction. January 31st last year, the proclamation of COVID-19 as a dangerous infectious disease. February 7th, CARPHA conducted its first COVID-19 test. I'm not going to go through all, but just to highlight some. March 12th last year, we recorded our first case of COVID-19. March 21st, 40 confirmed cases of COVID-19 from the Costa Fabulosa. You may remember that. Tobago recorded its first positive cases on March 23rd. March 25th, regrettably, the country recorded its first death. 30th of March, we reported our first 2 cases of local spread. And it goes on like that with all the responses, all the milestones. To date, as I said, we have conducted over 160 responses and statements based on policy. To date, we have issued over 36 regulations. We have issued over 611 press releases over the past year or so. We have had hundreds of press conferences. We don't know the actual figure as yet. Press conferences hosted by the Ministry of Health and by the Honorable Prime Minister himself. We have had parliamentary oversight on COVID itself. I myself have answered close to 20 questions in the Parliament. I have responded to 3 motions. We have had debates. We have had parliamentary oversight. The Prime Minister has answered about 3 or 4 urgent questions. You have had statements by myself as Minister of Health in the Parliament, and I myself have answered urgent questions in the Parliament. That is the sequence of activities that brings us here today, the new variant. And we did promise whenever there is something new of concern, we will come to the public as soon as possible, which we did yesterday. And now, less than 24 hours later, we are having an unscheduled press conference to update the public of our level of concern so that as a public, as a team Trinidad and Tobago, we can respond. And we can respond calmly, logically, in the best interest of all. The latest position, as you heard, is that we recorded our first UK variant yesterday. CMO will have given you the timeline. He would have known by about 12:30. I had a joint select. I had LRC meeting when I came back. He informed me. I then informed the Honorable Prime Minister, and we drafted the press release and so on so that the media and the public could be informed. As the CMO has said, we have been doing genomic sequencing since September 2020. And at this point in time, I want to thank most sincerely CARPHA and the University of the West Indies as sister agencies who have been working with us on this project. We could not have done this without CARPHA and the university. So I thank them and congratulate them. Having said all of this and given you a slight historical context of how Trinidad and Tobago has managed its part in the global pandemic, it must be noted that the global pandemic is not slowing down. It is not slowing down. As a matter of fact, we are going to reach a very significant milestone shortly. And I want the public to understand where we are with this now. So let me just give you some figures. Right now, the world is on the cusp of registering its 100 millionth case of coronavirus. Right now, we are at 98,221,297. We are on the cusp of our 100 millionth case. The total death tally around the world since I last spoke to you, and I did say we will cross 2 million, we have crossed 2 million. It is now 2,103,335. Average daily number of cases is still around the 750,000 mark per day. And deaths continue at a rate of over 15,000 deaths per day. So that's the state of play. With the advent of our first known case of the UK variant, the message to the public today is one of concern, heightened concern, and we are going to be continually reviewing the epidemiological evidence, as we have been doing since the start of the pandemic. Now is a time for all of us to be even more vigilant, and the best way to make sure this local variant does not spread. And it's a good thing we had our policies in place, because this variant, this index case, this one case has been successfully contained. And at this point, I want to sincerely thank the Minister of National Security, who has been managing the repatriation of nationals. The Minister of National Security's role in this successful campaign cannot go unnoticed. So it is one case so far, but we are continually reviewing the evidence. At this point in time, it is not the intention of the Ministry of Health to recommend any restrictions, further restrictions. That is counterproductive. But what we are urging is that members of the public, that small percentage who still either don't believe that this is an area of concern for them, especially the young persons who like to lime, especially now with gatherings, we are asking people not to gather. I myself was invited to a function next week, and I have declined. And thankfully, that function has been cancelled. Thankfully. So, in leading by example, I ask all Trinidadians, all Tobagonians, that whilst this new variant at this point in time is not in the general population, I have given you both the global context, how we fit into it, just to remind the population that the only and best tool or weapon we have against the virus right now are the public health measures. I know you are sick and tired of hearing about it, but it's my duty to remind you. What are they? Wear your mask. This simple piece of apparatus is going to save lives. This. Consider this your ICU. Consider this a medical piece of equipment. You see this mask? This simple two-ply mask? Whether it's a fashion accessory that you use or whatever, but this simple thing is mandatory. Wear your mask, whether you're on a beach. I was at Maracas last week, Saturday, I believe. And I was glad to see some people wearing their mask on the sand, but I was saddened to see some people not wearing their mask. Wear your mask. Distance, 6 feet, please. Importantly, stay home if you are ill. Don't spread it in the workplace. And a note to employers, it is your duty to put the necessary protocols in place that we have recommended for thermal screening, for recording temperatures, and make sure no one with a fever comes into your workplace. Wash your hands often. Soap and water or sanitize, alcohol-based sanitizer. Cough into a tissue on the crook of your hand and dispose of the tissue. A lesson which I have learned, don't touch your face. I was a notorious face toucher in the early days. And clean and sanitize surfaces, especially you see this thing called your cell phone, and don't let other people use your cell phone. Because when they talk into this, and then you talk into it, you transfer the virus. All hard surfaces, doorknobs, tables. When you go into a restaurant or a fast food outlet, don't assume they are going to clean the table. Walk with your own wipes, wipe down the table in your hamburger stand, wherever, in the malls. Take your own precautions. And if we can do that, as most of us have been doing, and I want to thank everyone who has been helping us with this. But there's still that little part of the population who doesn't get the message. 2021 will be a better year. We have the vaccine to look forward to in March, as Dr. Wheeler said on Wednesday, I believe. And if we continue to work with the government, to work with each other, we can protect our elderly from getting sick and from dying. So Candace, with those, I want to thank you for the opportunity to talk to the population for the past few minutes, and I turn over to you. Thank you very much.
Thank you very much, Minister, for that synopsis of the national COVID response since last year, and especially for ending us on some words of encouragement. Thank you so much. And we go now to question and answer segment. Members of the media, I see some are already prepared with their 2 brief questions. And just a reminder, we ask both questions at the same time, please. We begin with CNC3 this morning.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question is to Minister Dayal Singh. So you told us now is a time for all of us to be vigilant and not to gather. And time again, we've been hearing this messaging coming from the Ministry of Health and even head government officials at the Prime Minister. But are you concerned now that following the reports of non-adherence to COVID-19 protocols at a PNM rally in Tobago, at which the Prime Minister was present at, that this messaging may be compromised in any sort of way? And now my second question is for either Dr. Parsram or Dr. Hines. Seeing that the variant is now present in about 60 countries around the world, is it the intention of the Ministry of Health, or is it on the books for us to extend that quarantine period for other countries away from just travelers coming from the UK within 14 days? Or is it that you all are seeing this as, and like you said, Minister, an index case, and the public really has nothing to be worried about?
Okay, so I will take both questions, Rashad, and I want to thank you for the question. So any gathering, whether it's a political gathering, whether it's a PDP gathering, a PNM gathering, a UNC gathering, we have submitted our protocols to the Election and Boundaries Commission, and we urge all political parties in Tobago to adhere to those. And it's not only political gatherings in Trinidad. I'm glad you raised it. It is also these virtual fetes that are being held in Trinidad and Tobago now. And people are being encouraged to have carnival fetes in their backyards. So, Richard, you are spot on. Any gathering, whether it's political, by any political party, this carnival period, we have to be concerned. So, yes, we are concerned. 1. The second question about countries, as I said in my opening remarks, we are reviewing, as we have been reviewing, the epidemiological evidence. And we will be reviewing that now that we have this one isolated, contained case. It is too early to make knee-jerk panic reactions. We don't do that. We will have a considered, well-thought-out response for the population. But right now, the message is, as it has always been, the public health measures to protect yourself. Avoid gatherings, as I am doing. As I said, I was invited to something next week. I have declined. I am asking everyone to avoid gatherings of any type, whether it's a virtual fete in Queen's Hall, whether it's a Bird de Lime in Passage to Asia, whether it's a political event in Tobago. There are protocols that guide these things, and let's adhere to them. Thank you very much, Rashad.
Thank you very much. And we go now to 98.1, please.
And a very good morning to you, Ms. Alcantara, Minister Dayal Singh, Dr. Parsaram, Dr. Hines, Stephen Cummings, 98.1 FM. Just two quick questions, one for Minister Dayal Singh and the other for Dr. Parsaram. Minister, with the variant B117, would this have triggered not only the need for increased surveillance, but the need for a new kind of scientific and clinical reporting on the virus, which appears to us to be taking more of a continuous mutative characteristic? And Dr. Parsaram, there is the South African strain in addition to the UK, which we know of. How much do we really know about the efficacy of the vaccines that we may eventually acquire for our local population against these strains? And by furtherance, is it possible for a person to have two or multiple strains of the virus at the same time, possibly presenting with increased patient complications? Thank you.
Thank you, Mr. Cummins. Mr. Cummins, could you just elaborate on your first question to me about reporting? I didn't really get what you were trying. I didn't really understand the question. Just elaborate, please.
Yes, the first question had to do with the B117. Now that we are seeing a new, this variant, is it that is now we're going to be monitoring that, and that's going to be part of our official reporting? We usually have our 4 p.m. Updates, on a continuous basis. Is that going to, be part of the ministry's monitoring in terms of reporting to the population?
So the CMO will respond to that question.
Yeah. So what I had asked, I had actually written to Professor Carrington, UWI, asking that period. When you do a research study, normally what happens is at the end of that study, they analyze the data and they present results, right? Because of the utility of the study by way of picking up variants, it becomes something that is very useful to the government, to any country, by way of policy decisions, and of course knowing the patients. It becomes clinically important. So what I have done is I have written to UE asking that on every Friday they can provide me with a summary. So the summary will tell me basically how many tests they have done, how many negatives they have, how many positives they have, and which variant they pick up. So what we can do is possibly include that weekly summary, once I get it from UE, in the clinical update maybe once a week. And of course, if we so we can say if we have different strains as another line item in the press releases. So that can be done. Right. In terms of efficacy, we, as Dr. Hines, one of his slides would have indicated, there's research ongoing by way of multiple vaccines and the effect of the effect the variant is having in terms of efficacy. In particular, the Pfizer vaccine, and Pfizer has, the CEO of Pfizer had made a lot of comments in terms of the efficacy. But the research is still ongoing. Their statements, being Pfizer's statements, would have indicated that they don't think at this point it will significantly decrease the efficacy. However, of course, more research has to happen to determine what that decrease will be, if there is a decrease. So in terms of percentages, we don't know the percent effect on efficacy as yet for Pfizer and the other viruses. In terms of infection by multiple strains, again, only as of December of last year, new strains of concern would have been noted, and research has not suggested that there have been multiple infections with different strains as yet. But out of precaution, I would not want to discount the possibility at this point.
Thank you very much. And now we go to AZP News, please.
Hi, good morning. Priya Bihari, azpnews.com. My first question is for Minister Dayal Singh. Minister, I know you had a meeting yesterday with the Minister of Education. I just wanted to find out now, given this new strain, is there going to be maybe a policy shift in terms of school opening and focus more on the examination students, people who would write exam like CAPE, SEA, CSEC, etc. Would that be a change in policy now? Because some people might still be fearful now of sending their children to school. And my second question is the CMO. In terms of this new strain, are the healthcare workers maybe doubling up on the PPE, or is there a different set of measures that is going to be installed in the health sector when they deal with these COVID-19 patients now?
Okay,
thank you.
Thank you, Priya. So yes, yesterday, as promised, we did hold a meeting with officials from the Ministry of Education, led by the, and I just touched my face, led by the Minister of Education. We discussed matters pertaining to the opening of school. When we got the result of the new variant, I immediately, after I contacted the Honorable Prime Minister to alert him, I did in fact speak with the Minister of Education. And just to reiterate what I said at the beginning, at this point in time, we are not recommending or making any knee-jerk reactions. This is one case that we know of, which as per protocol has been isolated. So there is no need right now. However, any further communications about schools opening will come from the Minister of Education. We play a very critical supporting role, but the Minister of Health will not be making pronouncements as to when schools will open, which classes will come out. That will be the domain of my colleague, the Honorable Minister of Education, Nyan Gatsby-Dolly. Thank you.
Thank you. And now a news.
Second
question. Sorry,
yeah.
CMO.
So, in terms of the PPE, again, it is early on in terms of the variant and the research that is ongoing. Most of the variants that have occurred, the research has suggested it has an increased transmissibility, meaning it can go from one person to another more quickly. The reason for it, whether it is aerosolization or continued respiratory droplets, and what combination of those two things are increasing the spread between one person and the next, is not completely known at this time. Our protocols actually treat with those who are in contact. For example, persons that work at the Couva facility would be wearing what we call an N95 mask as per protocol, together with shields in most instances. And of course, in aerosolized environments, they will be wearing shields and the N95 mask together with what we call a Tyvek suit. So we are on the higher end of precautionary measures for COVID-19 than we need to be at this point in some instances. So we'll continue with our protocols for now, but if new developments do come by way of research, we will amend our policies then to suit what is being said. So what we know about the virus at this point in time I don't think there needs to be any change in the PPE policy or procedure, but as the research comes in and as more information comes in about the variants, of course we will amend those policies to suit.
Okay, and thank you. And now we go to Newsday.
Hi, good afternoon, Minister, members of the panel. Good morning, rather. So my two questions are, how will sports be impacted by this new news? Will there be any tightening of restrictions, or will we go back to only individual sports being allowed? And also, could you give us an update on which vaccines we'll be getting and when this should happen, and how many doses in all we've asked for?
Okay.
Thank you.
Thank you. So as I said, and I have no problems in repeating it again, we will continue to monitor, and right now, and I'm seeing it again this morning, we are not recommending any changes. Okay, so I hope I have made that abundantly clear. No changes are recommended at this point in time. I have said a couple of times for the morning, we are avoiding knee-jerk panic reactions. Any decisions we made will be well thought out in the public's interest moving forward. On the issue of vaccines, Dr. Wheeler was here on Wednesday, and the story remains the same. We are on track, according to Dr. Wheeler, to receive vaccines in March of 2021. That is the date we are looking at. I have said publicly that in the first instance, we are asking for, it doesn't mean that we will get it. We are asking for an initial shipment of 50,000, which will vaccinate 25,000 persons based on a two-shot regime. Your first shot, which is the primer, and the second shot, which is the booster. It does not mean that we may get all 50,000 at the same time. But that is what we are requesting in the first tranche, to vaccinate, according to WHO's protocols, healthcare workers, and those persons in long-stay homes, etc. So that's the plan as it is now. Thank you very much.
Thank you. And now questions from TTT, please.
Yes, hi. Good morning, gentlemen. Sunil Lala, TTT News. Minister, I was wondering, would there be any consideration or possibility of extending the time, which is the number of days in state quarantine for anybody that is probably tested for the variant? And finally, how long does it take to do this genomic testing for the variant? Is it being done for all persons coming into the country? How long? I know you said the person that he came in on the 6th, and this test just came in yesterday. Could you say how long that took?
Yeah. So I will take the first question, Sunil. As I said a few times this morning, we are not at this point in time making any knee-jerk or panic decisions. We are reviewing the data. We will continue to review it, and any decisions that any of the protocols we have right now are going to be well thought out and considered. But I will say it again, we are not making any changes right now to the existing regulations and or protocols. We will consider all the epidemiological information, and when we make changes, they will be based on the science, on projections, on trajectory, on whether this is found in the local population. But for right now, we are not making any knee-jerk or panicked decisions. We are concerned about the new variant. We are concerned, but we are guided by the protocols of 1, a closed border, 2, manage repatriation by the Minister of National Security, which has saved this country. 3, when repatriated nationals come in, they are quarantined for either 14 days or 17 days, depending on WHO's 7 days. No, from UK they are 14 days. Yeah. So 14 days for people coming in from the UK, as this particular case, and 7 days for other persons. If we decide to change that, it will not be done today. It will be done after we consider all the variables, and as usual, the media and public will be advised.
And the second question.
Second question.
Right. So as I said before, this is a study. So basically, it is a sort of retrospective look at the positives we get from the repatriations and possibly from other members of the population that have tested positive. Once we get the positives, we send them out. There's a process. So it goes across from the Caribbean Public Health Agency, who is the receiving lab, to the UE lab. And then the UE lab will do the sequencing thereafter. The actual process of sequencing, Professor Carrington has indicated, just takes a few hours. But in terms of the timeline for this particular person, I believe she would have gotten the sample on Monday and completed the genomic sequencing by way of batch testing by Tuesday and reported to me. So thereabouts, she took 3 days for this one, but the actual test, it can be done within a few hours if need be. If there's a particular concern with an individual test that we want a quick turnaround, we can alert CARPHA and then they will send it across quickly to UE.
Just by way of further elucidation, when UE first started this type of testing, initially it was taking 2 weeks, then it came down to 7 days, and now it's down to, in our case, 3 or 4 days. It was UE that first discovered the cases in Jamaica, if you would recall. So this is not a Trinidad and Tobago initiative. It's a CARICOM initiative where CARPHA collects the samples from the participating countries in CARICOM and then sends them across to UE St. Augustine. So that's the process. So again, I want to thank our sister agencies, CARPHA and the University of the West Indies.
Thank you very much, TV6. We're ready for your questions, please.
Good morning, Alicia Boucher from TV6 here. My questions would either go to Dr. Parasram or Dr. Hines. information in the public domain suggests that there can be relapses of COVID-19. I want to find out if we have any data at this time to show whether we have had any cases where patients have relapsed with COVID-19, and if so, is it as contagious, that relapse period, if we do have any cases, that is. The second question has to do with the time span. And I go back to that first case where the national came in, and I think he was here for about a month before that his symptoms started to show. Have we had any cases similar to that? And if so, have we had any cases where outside of the quarantine period or past that quarantine period, that person is still COVID positive? Thank you.
Those are good questions.
Okay, so in terms of defining what is a relapse and what is a recurrence is important to make the distinction. We have had cases of persons that would have been positive, discharged as per national protocol, gone home and had persistence or recurrence of their symptoms, coming back in and of course testing positive again. So that is one scenario that would have occurred. We also have scenarios where persons would have had the disease, been in ICU, been in other high dependency units for quite a long time, getting their negatives upon discharge in the early days of the epidemic, going home, and then of course just doing a routine screen, maybe pre-surgical screens, and coming back positive. We had discussions on what that means. For now, what it means is that we're picking up possibly remnants. Whether they are infective or not has not been proven either way, but they have been persons with prolonged positivity after being positive initially for quite a long period of time. So you have those two types of scenarios that have occurred locally. Internationally, there has been some recording of persons having de novo infections, being infected once and then infected again. So that has been documented internationally. But those are the three broad categories that we look out for. Our system hopes to pick up all of them by way of persons presenting to our facilities with symptoms, of course having a smear, and then turning back positive. So in all scenarios, we will pick it up. Academically, we look to see if it is recurrence, relapse, or if it is something else that is occurring. But we have seen a couple of those scenarios in our country. Internationally, there have been a number of other things occurring. The second question, Candice, if you could just remind me.
I think it focused on how long do the symptoms last. She mentioned a case with someone having symptoms with no symptoms for a month.
Oh, the quarantine. So picking up people outside of the quarantine period. With any quarantine period for a particular given infectious disease, 14 days is the benchmark period that you expect a person to present symptoms after being exposed to the virus. So 14 days is an average. In any particular virus, you can have outliers to that process. So you can have somebody, and research actually documented persons as long as 42 days post-exposure presenting with new symptoms. Now, it is difficult to tell if they would have had a second exposure somewhere. What we rely on is the history of the individual, which a lot of times gives a little difficulty to see exactly where you were all the time, to see if there was a potential exposure, second exposure. But generally speaking, the rule of thumb has been 14 days, and what we have seen by way of our repatriation exercises is that the majority of cases we pick up within that 14-day period. We continue to follow people, as you know, as per national protocol, for 7 days after the 14 days, when we had a 14-day in state supervised facilities, and even in those 7 days, persons had not presented with symptoms thereafter. So we go as far as 21 days, and we haven't picked up cases in that regard. Hope that answers the question.
Yeah. Thank you. Candice, I just want to go back to Richard's question about what he noticed in Tobago, and I try to contextualize it in terms of crowds in general. Someone sent me a WhatsApp. Good morning. Please address the situation with weddings. Some citizens are still having large weddings. Please say something about this. So I will not only speak about weddings or political parties. I told the media recently, well, just now, I went to Maracas on Saturday, and driving through the constituency, coming back in Samoa, I passed outside a church. I would not call it church. And that church was jam-packed. They flouted every single COVID regulation as far as spacing and 50% capacity. The point is, all gatherings, whether it's political, whether it's a wedding, whether it's a church, a mosque, a mandir, whether it's a birthday party in Passage to Asia, whether it's the concert in Queen's Hall, whether it's your anniversary gathering, whether it's your backyard carnival fets, all of these gatherings. Let's not focus only on Tobago right now. Let's focus on all potential areas of spread, which are gatherings. I mean, I was disturbed when I passed outside that church. You couldn't stick a pin inside the church. Totally flouting. And Minister Young, if I remember, Candice, you weren't there, up at the Prime Minister's press conference a few weeks ago, said he went into a church and he walked out. He said that publicly. Because as a minister of government, he didn't want to be associated or to be seen in a church which was flouting the regulations as per capacity. So I want to make a plea this morning. Anyone planning gatherings, please stick to the public health regulations. We have given guidelines to churches, places of religion. We have given guidelines to the EBC. We have given guidelines to the bars, casinos, cinemas. If we all, or if the majority of us are responsible, then as I said, we can make no adjustments to the regulations right now. Just please be responsible. Thank you very much.
Thank you very much, Minister. And we go now to Power 102 FM. Oops, not here now. I think your mic may be muted. I did the same this morning.
Are you kidding?
Yeah.
Are you hearing me now?
Lovely, lovely.
Perfectly.
Yeah.
And welcome.
Hi, morning.
I think this is the first time Power 102 is here.
Yeah.
Welcome, welcome.
Okay, so morning. Clyde Best here with Power 102 Izzo Media. My question is to Dr. Parasram. It has to do with the new strain, the B117. Are there any new or additional symptoms that we may need to look out for in terms of what is expected or that we should be aware of?
Right. So that's a good question. So far the symptoms that we know of are the same as for any COVID-19 patient. So the symptoms are the same. In this particular patient, the person actually has no symptoms at all. I confirmed that with the Chief of Staff of the hospital this morning. So the person is asymptomatic. But again, the symptomatology is more or less the same. So we look out for, in mild cases, sore throat, headaches, fevers, chills, generally feeling unwell, can present with diarrhea, in some cases vomiting. Of course, more severe cases will have shortness of breath and those sorts of things. So the symptoms are suggestively the same based on the research so far.
Power 102, you get the prize for question of the day. Today was your first day, but you get the prize for question of the day. Thank you very much.
Thank you very much.
I know, even I didn't think about that, whether the symptomology was different. So well done.
Thank you very much. And we go to our last question for this morning, 98.1, please.
And thank you again, Ms. Alcantara, getting the last question in. Well, it's more for a request. Minister Dayal Singh, one gets the sense that that there is need for a deeper understanding of the scientific process involved in gene sequencing. Is it possible, gentle request that we can get Professor Carrington in on the program very soon to kind of help walk us through this process?
Okay, you will have to share the prize for question of the day with Power 102. I think you have raised an excellent point, and we will endeavor to do that next week, Mr. Cummins. But that is an excellent suggestion. So the prize money has to be split between Power 102 and yourself. Sorry about that, Power 102.
Thank you very much. And we have come to the end of this morning's media conference. Today we presented on Trinidad and Tobago's first confirmed case of the UK COVID-19 variant, which was an imported case. You were reminded that all the protocols were followed We also looked at COVID-19 variants in general, and you were reminded of the importance of following all of the COVID-19 health recommendations, doing them properly and doing them consistently. Before we go to the short World Health Organization video on vaccines and variants, we remind you to be safe and wear your mask the right way every time. Do have a good day.
Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. This is WHO's Conversations in Science. And today we're talking to Dr. Sylvie Brion. She's the director of the Department of Global Infectious Hazard Preparedness. Sylvie's team tracks several dangerous and infectious pathogens around the globe. Welcome, Sylvie.
Hello.
Sylvie, we are going to talk today about myths and science